Good afternoon. Today is May 10th, 2020, and this is Victoria Ricken, and I am about to start my video for a head-to-toe assessment to fulfill Module 6 of Health Assessment. And today I have a model here to my right who is giving me permission to go ahead and do this study. This is assessment is intended to show my skills with the assessment actions only and is not used as direction for your health status or follow up with any irregular findings. Do you understand this?
Yes.
Thank you. So she is giving me permission to go ahead and get started. So what I'll do at this time is start my assessment. I'm going to go ahead and gel my hands first. Good afternoon.
Hi.
Can you tell me your full name and date of birth?
Catherine Lynn Anderson, June 11th, 1964.
Very pleased to meet you, Catherine. My name's Victoria. I'm a registered nurse working, who is studying for her Bachelor's of Science in Nursing, and I'm about to fulfill one of the module requirements for health assessment. May I go ahead and start my head-to-toe assessment with you?
Yes.
Thank you. There are portions of this assessment, though, where I'm going to need your eyeglasses off and also the mask to look in your mouth. Okay, you understand? And to do some of the structural, muscle, and cranial nerve assessment. Okay? So, at this time, I'm going to go ahead and check your temperature. You can take your mask off for me, please. And while that is registering, I'm going to go ahead and check your pulse ox if you want to stick your finger in here. Let's start with your ring finger. %. Your heart rate is 90, which is excellent. Your temperature is still registering. I'm going to go ahead and assess your respirations. Just breathe normally for me, please. Perfect. Your temperature is 98 too. And your respirations are 14. I'm going to go ahead and check your blood pressure. I'm going to slide this up a little bit better on your arm. Forgive me. Sorry if that feels tight to you.
No problem.
Your blood pressure is 112/70, which is excellent. Okay, so at this time, I'm going to go ahead and assess your head and your scalp and the skull bones on your head. Can you let your hair out for me, please? And while I'm doing this, I'm just checking to see if there is any kind of lesions or nodules. And it feels nice and uniform. There isn't any irregularity. Your hair texture is really soft and full. I don't see any areas or patchy areas of any balding. Beautiful. From there, I'm going to go ahead and palpate the arteries in your neck. I'm checking your carotid. You have a very full, even pulse. And then your temporal arteries. Forgive me. There we go. Very full and even. Now you're wearing eyeglasses. You wear eyeglasses every day
Yes.
for reading?
Yes.
Can you move your jaw for me? I would like to see if you have any clicking or, oh, I do feel some loosening in your jaw. Does your jaw click? Always? Yes? Okay. While your mask is off, I'm just going to go ahead and start feeling your lymph system. I'm going to go back behind your post-auricular, your occipital, from your occipital, I'm going to go down to your retropharyngeal, which is back here. From retropharyngeal, I'm going to go to your submandibular, submental, and from your submental, I'm going to go back down to your sublingual, supraclavicular, anterior, and then your posterior clavicular, and then your supraclavicular here. Do you ever have any swelling through here?
No.
No. You can put your mask back on if you wish at this time. I'm going to ask you to do a few muscle movements for me. Can you raise your eyebrows? Okay, and forgive me, can you pull your mask down? And show me at this time, closing your eyes tight. And then from there, smile and frown. Yeah, I like your smile. And then what I just did there is I assessed your cranial 7 nerves, and those are your facial nerves. They're all intact. I'm going to go ahead now and assess your cranial 12 nerves by asking you to say these 3 words for me: light, tight, and dynamite. Go ahead.
Light, tight, and dynamite.
Thank you. Perfect. You can go ahead and put your mask back on. I'm going to go ahead and feel now your thyroid. And it all feels really good. I didn't feel any nodules or any enlargement. It feels very regular and even through here. Very good. Now we're going to go on to your skin. Your skin looks beautifully tanned. You've been out in the sun. Do you wear sunscreen?
I do.
Awesome. What level of sunscreen do you use?
50 on my face and 15 on my body.
Okay. Well, your skin's really nice. It's nice and warm. It's soft. Can you hold your arms out for me, please? I'm going to take a look at your nails in your hands. You don't have any bruising or any irregular discolorations like moles, or I see a little scratch there. Could be from your dogs. Your cap refill on your nail beds is less than 3 seconds. They're nice and pink. Your distal fingers are nice and warm. There's no irregular with your temperature. Your skin turgor is a marker. We check to see if you have tenting. If your skin tense, then that shows us that you have some dryness, but I don't see any tenting at all. You're very moist, so that's awesome. You're doing a good job with your water intake. From there, we're gonna go ahead and look at your eyes. Okay, I'm gonna wash my hands again. Can't be too careful at this time. I'm gonna ask you please if you could just gonna touch your conjunctiva here, and I'm gonna ask you to look up. Very good. And down. Awesome. I don't see any redness or an inflamed or any erythema, which is redness in your eyes. Your sclera is nice and white, pearly white. I don't see any pink or redness in your sclera. Your iris, which is the coloration around your pupils, they're beautiful, beautiful blue.
Thank you.
Now I'm going to take a look at those pupils, if I may. Actually, I'm going to take a look at your corneas. I'm going to ask you to look straight ahead. And I'm going to look at the side to see if I can see any scratching or any abrasions. That looks great. Thank you. Perfect. I don't see any abrasions or scratches on your cornea. And now we're going to go ahead and look at your pupils. And I ask you to focus looking straight at me, and I'm going to come in from the side and just see your pupils. Your pupils are equal at this time. If I had the chart from work, I would be looking and assessing the size of your pupils compared to my pupil chart, but I don't have one at this time. But it looks as though your pupils are 2. The size 2, which is good. It's not that bright in here, so they would be smaller. Look at me. Perfect. And perfect. They're both equal and reactive to light, which is great. And then from there, I'm going to do a test. And this is going to, it's called the consensual response test. And I'm going to shine a light in your right pupil, and your left pupil should respond as well. But the light is only going to go into your, your right pupil. And I did see that change. Excellent. I saw your other pupil change with that. Now, I'm going to ask you to take a look at my finger, and we're going to check the accommodation of your pupils. And now, look at this for a few minutes, or a few seconds, please. And then look out the window at the car on the street. No, at my finger, and just beyond me. Back at my finger. Perfect. I saw your pupils accommodate to the location of what you were looking at. Now I'm going to take a look at the 6 cardinal fields of your gaze. I'm going to go ahead and use this pencil. When we do this, I hold this out about 6 inches away from your face, from your nose. And I'm going to ask you to track and follow this pencil. It is showing me how well your ocular nerves and your muscles are working together, okay? You ready? We're going to get started. Back to baseline and down, and baseline, left, right, up, down. Very good. And while doing that, I was checking your cranial nerves 3, 4, and 6. And I didn't see any nystagmus, which is an irregular eye muscle movement. And we would have picked it up on that if you had one. We're going to continue on, and I'm going to do the confrontation test. I'm going to go from your periphery, and you're going to tell me when you can start seeing my fingers come to you, okay? I want you to look straight ahead.
No. 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 No.
Perfect. Thank you. And with that, you could see all my fingers. I'm going to go ahead and take a look at your ears. The auricle of your ears are firm bilaterally. They are even on your head and on the same plane. They have good rebound. If I fold them, they come back. I don't see any lesions, any drainage or redness. Very good. Now, in another setting, I would have an otoscope for me to take a look inside your ears. For now, I'm going to pretend and see if I can find any lesions or redness or exudate or a larger amount of earwax. Are you having any problems with your hearing? Your ears look good. The internal structure of your ears look good, and your tympanic membranes look very nice and pink and healthy. No pressure on them, and they're not bulging. So now we're going to take a look at your mouth. Can I have you remove your mask again? I'm going to go ahead and just feel your sinuses. Are they causing you any pain or discomfort?
No.
Very good. Your external nose structure. I'm sorry, I didn't mean to startle you. I'm going to take a look at your internal nose structure. You have a deviated septum a little bit. You're a little bit red and pink on your right side. You having any nasal drainage? Yes?
Allergy.
Okay. In your oral cavity, I'm going to have you open your mouth, please. You have a beautiful set of teeth. Holy moly, you look great. I'm going to have you say ah. And with doing that, I'm checking cranial nerve 9, and that is your glossopharyngeal nerve. Perfect. Catherine, I'm going to ask you to stick your tongue out for me. Very good. Go to left, go to right. Awesome. I'm noting with Catherine that she does not have any facial dysymmetry. There's no mouth drooping, there's no ptosis of the eye. Everything is symmetrical. Very good. When I was looking at her mouth, I saw that her ulna, her uvula did rise when she said ah. Now we're going to carry on and we're going to do breath sounds. I'm going to move your hair to the front, Miss Catherine. I'm going to be looking at your back here and seeing if there's any tenderness or any areas of concern. Does your back bother you anywhere?
No.
I'm going to have you lean forward a little bit for me, please. Thank you. And I have you sit back and just breathe normally. Her breathing pattern is nice and easy and even. I don't see any rolling in of her shoulders where she is using any accessory muscles at all. And she has a beautiful straight posture. I'm going to go ahead and listen to Catherine's breath sounds in all areas. Take a deep breath for me, please. Again. And again. And again. I hear even distribution of air throughout all bases. I'm going to listen one more time right here, Catherine. One more time. Perfect. Now I'm going to be doing something where I'm going to ask you kindly to say 99 for me, please.
99.
One more time.
99.
One more time.
99.
One more time.
99.
I'm going to have you lean forward just a little bit. One more time.
99.
Very good. I'm now going to ask you to take a deep breath in, blow it out, hold it. You can breathe. Take a deep breath in, blow it out, and hold it. Very good. We're going to keep doing this in all 4 areas. Deep breath in, blow it out, hold it. Awesome. One more time. Deep breath in, blow it out, and hold it. I was percussing all 4 areas of your lung on the posterior side. And now I'm going to go to the anterior chest. I'm going to listen to your breath sounds. Anteriorly, take a deep breath in and out. One more time, please. And again. Perfect. Thank you. At this time, Ms. Catherine, I'm going to go ahead and check your carotids for a bruit. If you could pardon me one moment. I have to change my stethoscope. For this part of your assessment, I need to have 2 separate bells. So I apologize. I didn't realize at the time my other stethoscope. Just listening to see if you have any abnormal swishing in your neck. Sounds very good. And now I'm going to auscultate and listen to your heart sounds. Just going to feel your ribs for a minute. Here I'm listening for her aortic valve closing. The dub is louder than the lub. Over here, I'm going to listen for the pulmonic valve closure. Here, I'm listening to Erb's point. Your heart sounds great. A little bit lower, I'm listening to her tricuspid area, her tricuspid valve. And her mitral valve. Thank you. I'm going to do the same now, forgive me, with the bell of my stethoscope. And with this side of my stethoscope, I'm listening for any abnormalities like murmurs or swishes. And I don't hear anything. I'm gonna just go underneath your breast if you can hold it up for me. No, just lift your boob up. Excuse me. Your breast, forgive me. I don't hear anything. Awesome. I need to assess your abdomen. If I could just have you sit back for me, please. Can you raise your shirt? With this, I'm just going to be looking for any bulges or any abnormalities. Assessing all 4 quadrants. You please tell me if you have any tenderness anywhere where I'm pushing down. Your bowel habits regular?
Yes.
Do you ever get any burning or pain in your upper abdomen?
No.
No? Go ahead and percuss. Going to listen. For gurgles and swishes. You have good bowel sounds. Perfect. So now, Miss Catherine, we're going to look at your lower, your joints, your wrists, your elbows, if I may. Any swelling, bruising,
No.
full range of motion?
Yes.
Your knees and your ankles, which look great. Any pain?
No.
No? Can I have you hold your arms out? And I have you just hold resistance against me pushing you down, okay? Right? Left? Very good. Now I'm going to check for your pulses, which is your radial pulse. Which is 86. And from your radial pulse, I'm going to go ahead and check your dorsalis pedis. How'd you know I was going there? And your post-tibial, I just have to show where I'm, can you see her post-tibial on the medial aspect of her lower leg? You have good strong pulses bilaterally. Now I just have 1 or 2 more things to do with you, and then we will be through. Okay. And I ask you to please stand up and walk for me. Catherine does not have any shoes on at this time, so I'm going to see how her toe heel strike is. Her gait is even, balanced. You can come back. Thank you. Perfect. Thank you. I'm going to check your deep tendon reflexes. I thought I took my hammer out. I did. Can I see your wrist? Thank you. There we go. Finally got that to work. And that reflex was her brachioradialis reflex. And now here is her patellar reflex. Try to relax your leg. And she has a good patellar reflex. Now I'm going to do a cerebellar test, and I'm going to ask you to do several things repeatedly. I'm going to ask you to put your hands in pronation and supine on your legs, and repeat that back and forth, quickly. Increase. Very good. Tap your foot. Other foot. And then with your fingers, I want you to sequence all of your fingers to your thumb. And again, faster as you move along. Good job. Excellent. Thank you for your participation in this. And
You're
I
welcome.
really appreciate you helping me through this assessment. Dr. Dion, I believe that is it. And thank you for your time. And happy Mother's Day. You did tell me you're a mother. I did forget to ask you, what special day is it today?
Mother's Day.
And who is our president?
Gee. I like her very much. President Trump.
Okay, very good. And what state are we in?
Florida.
Yes. So she is alert oriented ×3, and she was able to perform this whole assessment being mindful and present with me. So thank you. Bye-bye now.
Bye-bye.